Pharmacy 2130, Pharmacy Administration. The two topics that we will cover is Understanding Managed Care and the Health Insurance Portability and Accounting Act. The learning targets for today are: I can describe the key concepts to managed care with regards to contracts, providers, and patients. I can list and a possible pharmacy technician code of ethics, and I can finally discuss the Patient's Bill of Rights and the Health Insurance Portability and Accountability Act. Medical contracts. In order to be reimbursed for services rendered, the pharmacy must sign a contract with the medical insurance provider. This is a legally binding document between the pharmacy and the medical insurance provider, and it will list what is and is not covered and any restrictions placed on dispensing medications. Some managed care definitions. A beneficiary, also known as eligible, enrollee, or member. Any person eligible as either a subscriber or a dependent for a managed care service in accordance with the contract. Benefit limitations. Any provision other than an exclusion which restricts coverage in the evidence of coverage regardless of medical necessity. A benefit package. The services a payer offers to a group or individual. A benefit payment schedule. It lists the amounts an insurance plan will pay for covered health care services. Benefits. Benefits are specific areas of planned coverage. For example, patient visits, hospitalization, and so forth, that make up a range of medical services that a payer markets to its subscribers. Also, it's a contractual agreement specified in an evidence of coverage, determining coverage services provided by the insurers to the members. Claims review is a method by which an enrollee's health care service claims are reviewed prior to reimbursement. The purpose is to validate the medical necessity of the provided services and to be sure the cost of the service is not excessive. A co-payment is a cost-sharing agreement in which the HMO enrollee pays a specific flat amount for a specific service. For example, $2 for an office visit or $1 for each prescription drug. The amount paid must be nominal to avoid becoming a barrier to care, and it does not vary with the cost of the service, unlike co-insurance, which is based on some percentage of cost. Cost sharing is a general set of financial agreements whereby the consumer must pay out of pocket to receive care, either at the time of the initiating care or during the provision of health care services, or both. Cost sharing can also occur when the insured pays a portion of the monthly premium for health care insurance. Deductibles are amounts required to be paid by the insured under a health insurance contract before benefits become payable. A dependent is in a payer's policy of insurance, a person other than the subscriber eligible to receive care because of a subscriber's contract. Discounted fee for service. An agreed upon rate for service between the provider and the payer that is usually less than the provider's full fee. This may be a fixed amount per service or a percentage discount. Providers generally accept such contracts because they represent a means to increase their volume or reduce their chances of losing volume. A formulary is a list of selected pharmaceuticals and their appropriate dosages felt to be the most useful and cost-effective for patient care. Organizations often develop a formulary under an aegis of a pharmacy and therapeutics committee. In HMOs, physicians are often required to prescribe from the formulary. Medicaid is a federal program run and partially funded by individual states to provide medical benefits to certain low-income people. The state, under broad federal guidelines, determines what benefits are covered, who is eligible, and how much providers will be paid. All states but Arizona have Medicaid programs. Medicare is a nationwide federal insurance program for people aged 65 and older. It also covers certain people under 65 who are disabled or have chronic kidney disease. Medicare Part A is the hospital insurance program. Part B covers physician services. Medigap is a private health insurance plan that supplements Medicare benefits by covering some costs not paid by Medicare. Open enrollment is a period of time which eligible subscribers may elect to enroll in or transfer between available programs providing health care coverage. Patient liability is the dollar amount which an insured is legally obligated to pay for services rendered by the provider. A participating provider is any provider licensed in the state of provision and contracted with the insurer. Pre-existing conditions. A physical condition of the insured person which exists prior to the issuance of his policy or his enrollment in a plan, and which may result in limitations in the contract on coverage or benefits. Physical condition including an injury or disease that was contracted or occurred prior to enrollment in the HMO. Federally qualified HMOs cannot limit coverage for pre-existing conditions. Code of Ethics. A pharmacy technician promotes the good of every patient in a caring, compassionate, and confidential manner. He or she places concern for the well-being of the patient at the center of professional practice, considers needs stated by the patient as well as those defined by health science, dedicated to protecting the dignity of the patient. With a caring attitude and compassionate spirit, a pharmacy technician focuses on serving the patient in a private and confidential manner. A pharmacy technician respects the autonomy and dignity of each patient, promotes the right of self-determination, and recognizes individual self-worth by encouraging patients to participate in decisions about their health, communicates with patients in terms that are understandable. In all cases, respects personal and cultural differences among patients. A pharmacy technician acts with honesty and integrity in professional relationships, has a duty to tell the truth and to act with conviction of conscience, avoids discriminatory practices, behaviors, or work conditions that impair professional judgment, and actions that compromise dedication to the best interest of patients. A pharmacy technician maintains professional competence, has a duty to maintain knowledge and abilities as new medications, devices, and technologies become available and as health information advances. A pharmacy technician respects the values and abilities of colleagues and other health professionals, asks for consultation of colleagues or other health professions, or refers the patient, and acknowledges that colleagues in other health professions may differ in their beliefs and values they apply to the care of the patient. A pharmacy technician respects the autonomy and dignity of each patient, promotes the right of self-determination, and recognizes individual self-worth by encouraging patients to participate in decisions about their health, communicates with patients in terms that are understandable. In all cases, a pharmacy technician respects personal and cultural differences among patients. A pharmacy technician serves individual, community, and societal needs. The primary obligation is to the individual patients. However, the obligations may at times extend beyond the individual to the community and society. In these situations, the pharmacy technician recognizes the responsibilities that accompany these obligations and acts accordingly. Patient's Bill of Rights. Information disclosure. Accurate and easily understood information about your health care. Assistance will be provided if you don't understand, so you can make informed medical decisions. Choice of providers or plans. You have a right to choose a health care plan that is sufficient to provide you access to appropriate high-quality health care. Participation in treatment decisions. To know your treatment options and to participate in decisions about your care. Other individuals designated by you can make these decisions if you are unable to make your own decisions. Respect and non-discrimination. Considerate, respectful, and non-discriminatory care from your doctors, health plan representatives, and other health care providers. Confidentiality. Discussion with healthcare providers are protected and confidential. Ability to review and copy your own medical information with the ability to correct errors and to delete irrelevant information. Health Insurance Portability and Accountability Act is a law that creates standards dealing with the privacy of health information, which helps prevent improper use of one's medical records. Civil penalties for violating this act include a $100 to $25,000 fine per person per violation per year. Federal criminal penalties range from $50,000 to $250,000 and up to 10 years in prison, depending on the circumstances surrounding the violation. For next week, make sure you have watched the notes for the following week and read Chapter 5 for next week. Do the chapter reviews as you need.